Remaking the healthcare system. It's a critical night for President Obama as he delivers a major speech to Congress and to all of us. Congressman Charles Boustany of Louisiana will give the Republican rebuttal to the president's speech. Boustany is also a heart surgeon and the only Republican doctor on the House Ways and Means Committee, and he joins us now from Capitol Hill. Good to see you.
Great to be with you.
Okay, we understand the president is still tweaking his speech before Congress. Are you still working on your rebuttal?
Of course, and as we get information from the White House, it'll also help me decide on what exactly needs to be in our rebuttal.
What items do you know you will likely have in your rebuttal?
Well, Frederica, it's important to recognize that health care reform is such a complex topic, and health care affects every man, woman, and child in this country. So the most important thing to do is to get it right. And that's what I'm going to emphasize.
So you do think there needs to be a reform plan, but define what you think needs to be in it to make sure it's right.
That's exactly right. We are for reform. We do believe that we have to provide a system that creates access to a doctor-patient relationship first and foremost for all Americans.
Well, the president would be saying that too, but what would be different? What do you suppose needs to be in it to make it right? Just using your words, to make it right.
Well, first of all, I think what we need to recognize is that there are a lot of things that we agree upon. Why don't we start there rather than starting with a very contentious approach that's been advocated, and in fact, an approach that's sort of been the only thing advocated in healthcare reform, and that is a government plan. I believe there are many other things that we could do to improve healthcare delivery, lower the cost, and we're going to have some specifics that are out there on a website, and of course I'll mention some of those things in my speech tonight.
So what are those things that you know that you already agree upon that you want to push forward?
Well, we agree that first of all we need to have insurance reforms. The pre-existing condition issue is very important. That's one, and there are many other areas, and I don't want to get into all the details of what I'm going to say tonight, but you know, let's just suffice it to say that there are a lot of things that we can agree on, and that's where we need to start. And let's get this right. That's what the American people want first and foremost.
So as a cardiothoracic surgeon, are you still a member of the American Medical Association?
No.
Okay, well,
I've not been a member of the American Medical Association for quite some years now.
Okay, initially, when the president spoke before the AMA, many members were reticent about his message and as a whole did not necessarily agree with the president. Today, the headline is the AMA says it is behind the president's health care reform plan. How does that sit with you? Well,
I'm opposed to the House bill that we covered in committee, in the House Ways and Means Committee. I voted no after we tried to amend the bill. There are a number of problems with this bill, and it's unacceptable. Keep in mind that the AMA only represents somewhere around 15% of physicians, and a number of state medical societies have actually taken positions opposite of the AMA. But again, it's so important that we get this right. Let's put all the options on the table and thoroughly vet these options. You know, Frederica, even with the government option, there are a lot of remaining unanswered questions that were not covered when we had hearings and even during the markup of the bill. And I don't think that's a responsible way to go about doing health care reform.
Okay, given your experience in the medical field, and you also know what it's like to be uninsured, I understand for a period of time in your life you did not have health insurance, you had no coverage whatsoever. Have you reached out to the White House to express your personal opinion and your personal experience about how to get it right? You keep saying we want to get it right. Everybody wants to get it right, but have you offered any ideas about how to get it right?
I've mentioned a number of ideas to the White House liaison to the House and asked for meetings with some of the staff higher up and even the president himself. And frankly, there really have not been any discussions between the White House and House Republicans. And that's some concern to me. I'm quite frustrated, to be frank with you, because we do have a number of very substantive ideas that we could put forth.
Okay, Representative Charles Boustany, thanks so much. We look forward to hearing your rebuttal this evening after the president's address to the joint Congress this evening.
Thanks
so much for your time on Capitol Hill.
Thank you very much.